Well, the month of May is Mental Health Awareness Month.
And joining us now is Larsen. She's the CEO of the Steinberg Institute in Sacramento. Thanks so much for joining us. First question here, why is there still such a stigma surrounding mental health?
I think there's a couple of different kinds of stigma. There's our own internal stigma where we sometimes carry around shame around our mental health systems and a fear of asking for help. And then there's sometimes generational issues. Sometimes our older generations carry a little more stigma based on when they were raised. And certain cultures also carry stigma around asking for help or seeking help in the mental health system. I think that's part of the reason why we choose the term brain health at the Steinberg Institute. The brain is an organ, just like other body organs, like your heart or your liver or your kidney. And we'd really love to see less stigma and mental health being treated like any physical health condition.
Yeah, your body gets sick, your brain can also get sick. But of course, we know everybody feels down sometimes. You have bad days. When do you know that it's becoming more of a mental health issue? When does it cross that line?
It's a great question. I think, we've all struggled, especially over these last few years. And I think when it starts to interfere with your activities of daily living, maybe it interferes with your sleep or your eating or your relationships or your ability to go to work or school, that's when we really have to start paying attention to those symptoms and figure out a way to get help and get back into mental wellness.
Some people are in denial. Maybe it's a family member or a friend suffering, but they don't want to get the help. What's the best way to approach the issue with the people struggling, and what help is available? What should they expect?
It's hard to get help right now. There is quite a workforce shortage in mental health throughout all of the health systems. And so getting that help is sometimes difficult, but there are other things people can do besides our traditional therapies. You can encourage your loved ones to connect with others, eat healthy, sleep well, do community service activities or other things that bring them joy, things that help fill up that tank when maybe you're having a hard time getting into therapy.
Talk about the struggle for kids. What's your advice to parents who have kids that are suffering from mental health issues?
Gosh, this is the moment. I think all of us that are parents are worried about our little ones. They have struggled so much over these past few years, and they've lost so much, social connections and academic and rites of passage. And so, and as I mentioned, there's a workforce shortage, and it's hard to get them some of those traditional therapies when we want to get them into help. So I think it's very similar to those things I mentioned earlier. As a parent, you know what brings your children joy, and if you can get them connected to those things that bring them joy, the more you can do of that, the better it is for them. Just really focusing on those healthy coping strategies and building those up for your children help to build their resilience and keep them away from some of the unhealthy coping strategies that they can easily fall into, like too much screen time or other things.
Well, good things to add to our tool belt, but revisiting, the most troubling thing you said there is there aren't enough mental health professionals. And the last thing you want to hear about is somebody who needed help, who wanted help, who could not get help. What is your best advice if somebody really is having an emergency and they need that help to cut through that line, to get right to the front of the line and get help?
If you think someone's in crisis, at risk for suicide or exhibiting signs that they need immediate help, you can always call 911. Come July 1st, you'll be able to dial a different number, 988 for mental health crises, but you can always call 911. If it's not quite at that level, you can call your healthcare system, whether that's Kaiser or Sutter, or even if you're a Medi-Cal recipient, there are 24/7 numbers available at all of the healthcare systems, specifically for mental health access and crisis.
Right. Well, Karen, thanks so much for this important conversation this afternoon.
You bet. Thank you for having me and for shining a light on mental health.